So good evening to all. So today's class is regarding the CHN, means the community health nursing. In the first class, we will welcome to all and start the definition of health according to WHO. First we start the definition of health. Of health. कହାର ना WHO. Definition of health according to WHO. ହେଲା କ'ଣ ନା mental well-being, social well-being and the physical well-being. ହେଲା mental, social and physical well-being. ହେଲା triad କ'ଣ ତାର mental well-being, physical well-being social well-being. Clear? So WHO definition of health is a complete state of mental well-being, physical well-being and the social well-being. That is the health triad diagram. That is the health triad diagram. Health triad. Health triad. Health is a complete state of mental well-being, physical well-being and the social well-being according to WHO. This is the health triad. Then the concept of health. Concept of health. Concept of health. Look, there are four concepts in health. First, the four concept of health. Here, four concepts. First one is the biomedical concept. That is the first concept is the biomedical concept. Then ecological concept. Yeah, that is the second concept is the ecological concept. Then psychosocial concept. Psychosocial concept. Yeah, psychosocial concept. Then fourth one is the holistic concept. Yeah, the concept of health is in four types. That is biomedical concept, ecological concept, psychosocial concept and the holistic concept. So write down this. Then we move to the dimensions of health. Yeah? Then we move to the dimensions of health. dimensions of health. Then dimensions of health. First is the physical dimensions. First one is the physical dimension. Then second one is the social dimensions. Third one is the spiritual dimensions. Then the fourth one is the emotional dimensions. Yeah. First one is physical, social, spiritual, emotional, and fifth one is the mental. Yeah. There are five dimensions of health. Five dimensions in health. First one is the physical, second one is the social, third one is the spiritual, fourth one is the emotional, and fifth one is the mental. That is the dimensions of health. Then, what is community? What is community? Community, a group of people sharing common needs, interest. Yeah. So write down this: a group of people sharing common needs, interest, resource, and environment. Resource and environment. Yeah. What is community? Community is a group of people. Is a group of people that sharing common needs to each other, common interest to each other, and common resource to each other, and environment. That is the community. That is the proper definition of community. Then we move to the community health triangle. Means who will include in the community health triangle. Okay. Health triangle. Community health triangle. Community health triangle. First the community. Yeah. In the community health triangle, first the community, then health problems, then third one is healthcare services. Healthcare services. Okay. This is the community health triangle. In community health triangle, there is community people and their health problems and their health problems. Okay. Then to correct the health problem, there is the health care services. Yeah, this is the community health triangle. In community health triangle, there are in community people and community people's health problem, and to correct the health problem, there in the health care services. That is the triad or triangle of community health service. Then we move to the nursing process flowchart, that is very important. Now, nursing process flowchart. Nursing process. Nursing process. First one is the assessment. Clear? That is the nursing process flowchart. First one is the assessment. Second one is the diagnosis or identification. Second one is the diagnosis or identification. Third one is the planning. Fourth one is the implementation. Fifth one is the implementation, and fifth one is the evaluation. Fifth one is the evaluation. That is the nursing process flowchart. First we assess the people. Then we diagnose or identification the disease. Means any investigation required, any X-ray, any CT scan, those are required to do the people. And planning. According to diagnosis, we plan the treatment. Then implement the treatment. Then the implement to the treatment. Then after implementation, then we evaluate. The result. How the treatment is effective. Okay? That is the nursing process flowchart. As we assess, then the diagnosis or identification via any investigation, then we planning the treatment, then implement the treatment, then evaluation the treatment. It is right on this, that is important. So next class we will discuss the tomorrow, that is the introduction class. Next class we discuss tomorrow, so read carefully so that you memorize better. So thank you to all.